Hello everyone, my name is Kylie and this is my presentation on Lucemyra. Today I'm going to go over a really quick overview of what Lucemyra is and how it works, the symptoms of opioid withdrawal and the symptoms of Lucemyra, dosage, single and daily, and the clinical trials. So Lucemyra, also known as ofexadine, is a brand name oral tablet that suppresses the symptoms of opioid withdrawal. In November 2017, the Food and Drug Administration, also known as the FDA, accepted and granted prior reviews of Lucemyra. In May 2018, Lucemyra was then approved and hit the American market in August later that year. What Lucemyra is and how it works. So Lucemyra is the first non-opioid drug that suppresses the symptoms of opioid withdrawals. Opioids reduce the amount of norepinephrine that the body produces. So when an individual has taken opioids for a long period of time, the body gets used to the drug, resulting in an overproduction of norepinephrine. Lucemyra works by blocking that release, and so it's blocking the release of norepinephrine once someone has stopped taking opioids suddenly. Norepinephrine is a hormone that leads to the increase of withdrawal symptoms. It also supports key functions in respiration and consciousness. So Lucemyra is not used as a long treatment for opioid addiction. It should only be used when it is stopped being taken suddenly. So the opioid withdrawal symptoms and the symptoms of Lucemyra. So the symptoms it suppresses are anxiety, insomnia, muscular tension, body aches, chills and feeling cold, vomiting, diarrhea, fever, or high blood pressure or a pounding sensation in the chest. Side effects that may be present are dizziness or feeling lightheaded, drowsiness, slow breathing or a slow heartbeat, dry mouth, fainting, ringing in the ears, or an allergic reaction. If an individual has any of these symptoms or signs that are present, they should contact their doctor immediately. Dosage, single and daily. So the starting dose of Lucemyra is 0.18 milligrams, or milligram tablets, or 0.18 milligram tablets, sorry. Total amount taken is 0.54 milligrams, taken orally 4 times daily, or for 5 to 7 days. However, it can also be continued for a total of 14 days if the doctor recommends. A single dose should be taken in intervals between 5 to 6 hours. Lucemyra can also be taken with or without food depending on the individual's preference. A single dose should not exceed 0.72 milligrams or 4 tablets at once. And a daily intake should not exceed 2.88 milligrams, 2.88 milligrams or 16 tablets. Lucemyra is available in 36 or 96 tablet bottles. Now we're going to do the video. The video just gives a really quick explanation of what Lucemyra does at a synapse. Give me 2 seconds.
In the locus coeruleus area of the brain, neurons are naturally in a state of equilibrium, releasing just enough norepinephrine to promote normal levels of essential physiological functions, including wakefulness, muscle tone, and respiration. Opioids link to mu-opioid receptors on the surface of locus coeruleus neurons and suppress the downstream release of norepinephrine, producing the typical opioid effects of analgesia, sedation, depressed respiration, and reduced blood pressure. Over time, with sustained chronic opioid use, the delicate biochemical balance is readjusted to enable the neurons to again release approximately normal levels of norepinephrine. When opioid tolerance has been established, Increasingly higher opioid doses are required to achieve the same physiological effects. At this stage, removal of opioids results in a massive surge of unopposed norepinephrine. This surge initiates widespread norepinephrine-mediated activity and results in opioid withdrawal symptoms, including feeling sick, stomach cramps, muscle spasms or twitching, feeling of coldness, heart pounding, muscular tension, aches and pains, yawning, runny eyes, and insomnia or problem sleeping. Lucemyra is an oral, non-opioid central alpha-2 adrenergic receptor agonist that binds to receptors on adrenergic neurons. This reduces the release of norepinephrine and decreases sympathetic tone. The suppression of norepinephrine release by Lucemyra mitigates the symptoms of noradrenergic hyperactivity, withdrawal symptoms, that occur when the inhibitory effect of opioids is abruptly removed.
It's going to think really hard. So the clinical trials. So study 1 was a dose response study testing the efficiency and the safety of two different doses of Lucemyra with a matching placebo. The study was conducted on patients with an opioid dependency on short-acting opioids. Examples of that are heroin, hydrocodone, oxycodone, and morphine sulfate. So it was a 7-day trial. Group 1 was given a dose of 2.16 milligrams of Lucemyra, which is a total of 0.54 milligrams, which is 3 tablets taken 4 times daily. Group 2 was given a dosage of 2.88 milligrams of Lucemyra, which is a total of 0.72 milligrams, which is 4 tablets taken 4 times daily. And group 3 was a matching placebo. So the first graph here shows the percentage of individuals completing the trial over a 7-day period. So the bottom line here is the placebo. The solid line is the Lucemyra 2.88 milligrams. And the top line is the Lucemyra 2.16 milligrams. So day 1 to 3 shows the most decrease in patients completing the trial. Day 4 to 7 shows a fairly steady rate, so symptoms probably got less severe. Figure 2 shows the severity of symptoms from a rating of 0 to 30. So the bottom line here is Lucemyra 2.88 milligrams. The middle line is the Lucemyra 2.16 milligrams, and the top line is the placebo. The graph shows that day 2 had the most severity for all 3 groups. Following day 2 showed a very steady decline in all of them. And it also showed that for day 2, the placebo had the highest rating of 14. This is just a summary of everything that I just went over. So out of all patients total, 28% of placebo patients, 41% of Lucemyra 2.16 milligrams, and 40% of Lucemyra 2.88 milligrams patients completed the 7-day trial. Those patients who completed then became eligible for continuation, or for the second part of the trial, which was a continuation of the drug use over 8 to 14 days, or the following 8 to 14 days. Clinical trial 2. So the study 2 was a randomized placebo controlled study comparing Lucemyra 2.88 milligrams to a matching placebo. The trial focused on patients, again, with an opioid dependency on short-acting opioids. The trial lasted for 5 days. Patients who then completed the trial were eligible to continue for a following 3 days. Patients also had access to a variety of different medications as well. So it was a 5-day trial. There was a total of 246 patients. 134 of those took Lucemyra 2.88 milligrams, which is a total of 0.72 milligrams, which is 4 tablets taken 4 times daily. And then 130 patients took a matching placebo. So again, the first graph here shows the percentage of individuals who completed the trial over the 5 days. The bottom line is the placebo. The solid line is the Lucemyra 2.88 milligrams. So the biggest decrease was between days 1 and 3. And also the biggest decrease was shown in the placebo group. Figure 2 shows the severity of the symptoms from a rating of 0 to 30. So the bottom line here is the Lucemyra 2.88 milligrams. The top line is the placebo. So the graph shows that most of the Lucemyra patients had a way less severity, but it also the graph also shows that the placebo group on day 2 had the highest rating of 13. Again, this is just a summary of everything that I just went over. So from all of the patients who started the trial, 33% of the placebo patients and 49% of the Lucemyra patients completed the treatment. Patients then were allowed to continue the use of Lucemyra or placebo for a following 3 days after the study. And those are my references. Thanks for watching.